The pulmonary arterial hypertension, or PAH, is an increase of the blood pressure in the pulmonary artery. This high blood pressure goes from your heart to your lungs. The heart has to work harder to pump the blood through. The symptoms are shortness of breath, tiredness, chest pain, a racing heartbeat, decreased appetite, pain on the upper side of the abdomen. The morbidity and mortality of patients with PAH are increased by 40% with vasoactive substances. The treatment: patients with left heart failure or hypoxemic lung diseases, groups 2 or 3 pulmonary hypertensions, should not routinely be treated with vasoactive agents, including prostanoids, phosphodiesterase inhibitors, or endothelin antagonists, as these are approved for the different condition called pulmonary arterial hypertension.
Pulmonary arterial hypertension, or PAH, is a serious condition for which there are approved treatments but no cure. This disease affects people of all genders, races, and ages, but it's more prevalent among women in their childbearing years. Adcirca is the first once-a-day PDE5 inhibitor oral therapy for the treatment of PAH. It offers significant improvement in exercise capacity and has shown to consistently improve certain aspects of health-related quality of life for patients with PAH, such as climbing stairs, doing laundry, or even dressing. Dr. Sanjay Mehta is a Canadian physician who specializes in PAH.
Pulmonary arterial hypertension is a very important and serious disease of the lungs where the blood vessels become narrowed and sometimes scarred to the point of being closed. As a result, patients experience shortness of breath, tiredness, and eventually weakness of the right side of the heart, with passing out, swelling, and eventually a high risk of death.
The surgical view, or the cure. The cure is a lung transplant. Surgery cures pulmonary arterial hypertension, but leaves the patient with the complications of transplantation and a post-surgical median survival of just over 5 years. In the epidemiology, idiopathic pulmonary arterial hypertension is a rare disease with an incidence of about 2 to 3 cases per million per year and a prevalence of about 15 per year per million. Adult females are almost 3 times as likely to present with IPAH than adult males. The presentation of IPAH within children is more evenly split along gender lines. In the diagnosis, because pulmonary arterial hypertension can be of 5 major types, a series of tests must be performed to distinguish pulmonary arterial hypertension from venous, hypoxic, thromboembolic, or miscellaneous varieties.